Hello students, we will show a common clinical sign which we come across in our surgical practice, very common one. Just see this one, what this sign is. See, look at that, there is a swelling here in the nape of the neck towards the left side, and clinician's finger is pushing like this. What this sign is, a very typical sign. So this is nothing other than slip sign seen in lipoma. So what is lipoma? All of you know that. It is a benign tumor or a neoplasm arising from yellow fat, because tumor arising from the brown fat, which is not common, it's the fetal fat, it is called as hibernoma. So it is once in a while seen in infants. This lipoma can be diffuse or localized, it can be single or multiple. Painful lipomatosis can be seen in females, and multiple one that is called as Derkham's disease, often asked as MCQ question. Different types and sites are common. Remember, all over the body it can occur. Subcutaneous tissue, intramuscular, submuscular, intra-articular, inside the bone also it can occur, and everywhere except of course brain matter it won't occur. Otherwise everywhere in the organ also it can occur, submucosal, intestine, lungs, everywhere it can occur. That's why it is called as universal tumor, also called as ubiquitous. It's the commonest benign tumor, remember. Commonest benign tumor in the body is lipoma. That point you have to remember, and remember it won't turn into sarcoma. Lipoma per se will not turn into sarcoma. It's not a precursor. It's not a precursor tumor, and so you have to remember complications are saponification, calcification. These are the usual common complications. Of course, pain can occur because of the painful neurolipoma, neuromatosis like that, or lipomatosis. Can go through how to examine lipoma or swelling. Can go through my clinical methods in surgery with the video lectures. You can go through my SRB's manual surgery for detail about lipoma, because a common case kept in the exam, worksheet is kept, MCQs will be asked, and lecture and theory also it may be asked. My surgical operation gives in detail about the different operations, in detail, the 2 volume, everything, operative procedure given in detail, and tissue approximation shows how to suture, how to do the tissue approximation by proper suturing with the video lecture. My DigiNour lectures gives a entire idea about the surgery subject for UGs with the CBM syllabus, and PGs and learners, beginners. It includes briefly about the specialty also, including all general surgery topics, and also includes operative surgery briefly, and instrument X-ray specimens and specimens. So students, I hope you understood what is slip sign. It's very, very important. Thank you very much.